Essential medicine stockouts have reportedly negatively impacted the health sector, where patients cannot afford to purchase drugs from private health facilities.
Others who can still not afford to do that. For example, you take drugs for malaria for 3 days, for maybe 2 days, and when they feel some bit of improvement, they sit back, and they have not been able to complete the doses. Now, this has brought a lot of negative effects, and one of them has been the drug resistances we are getting today. You realize that every now and again, new medicines for malaria are being rolled out.
Civil society organizations now want government to increase funding to the Ministry of Health to ensure constant availability of drugs in health centers.
We want the current budget allocation for procurement of medicines under the National Medical Stores Vote 116. It should be revised upwards to cater for the ever-increasing number of morbidity cases treated at various levels of care and to match up the population increase. In other words, we want the government to allocate adequate budget for health, for essential medicines and health supplies, but in addition to ensure timely disbursement of funds to the national medical stores to ensure that the supply and distribution of essential medicines and health supplies is not interrupted by the mechanisms for financing.
If we can airlift individuals, can't we airlift drugs and deliver them timely to where they are needed? Because absence of drugs means people are losing lives, families are being incapacitated, and this whole generation is being incapacitated.
The chairperson Parliamentary Committee on Health, Dr. Charles Ayume, stressed the need for National Health Insurance Bill, which he says is at the floor of Parliament waiting for decision.
With National Health Insurance, it doesn't mean that all our problems are going to go away. It's just a conduit for domestic financing. It has its advantages like solidarity. You know, when you're paying for something, there's definitely more. You're a bit frugal in the way you spend than when it is entirely free.
Mary Namkose, Irene Faith Nantongo, UBC News.